Good morning, folks. How are you guys today? Good morning, anybody out there? Good morning, Macy. Hope you had a nice weekend. Good morning, April. Hi, Brittany. Hello, Nikki. Hi, Daisha. Good morning, Eugene. Hi, Katie. Hi, Anna. That's a little better, and then wash out the picture. Hi, Caitlin. Good morning, Amanda. Let's see, Miss Shavia and Randall. Okay, just those two. Give them a couple of more minutes. It might be kind of busy this morning again. think that's all we're missing. Okay, let's do this. Let's go to page 619 in your textbook. 619. That's in chapter 20. Okay, on 619, you can see that's part of the urinary tract. And as you know, urinary tract infections are not uncommon. And so I think if I remember correctly, back in chapter 15, I believe it was, when we talked about the hospital-acquired infections, that 40% of them were urinary tract infections, UTIs. That's short for urinary tract infection. URI is an upper respiratory infection. So you got to keep them a little bit separated there. They're somewhat similar. But as you look on page 619, you know, the urethra is open to the environment. And of course, the urinary tract, the reproductive tract, and the GI tract are pretty close together. And so it's certainly possible to have a transfer of microbes if things are not done correctly and properly. So there's where you need a little bit of training as children. One day, Mr. Malachowski, who was teaching a microbiology course, had the kids catch urine in a cup, and then they brought the cup back to the lab, and they took a swab, and they put it down in the urine, and they put it on EMB. Remember EMB? That's the eosin methylene blue agar. It's really selective for gram-negative rods, but it's also differential in the sense that can an organism ferment lactose or not ferment lactose. And so the kids did all of that, and they set it in the incubator for 24 hours and came back and took a look at it. And Mr. Malachowski called me over one day when we were close to the lab. He said, I want to show you something. This is one kid's urine specimen. Now, it's normal to have some microbes about the urethra, maybe about a quarter inch or a half inch up into the 3/8 of an inch up into the urethra, to have some microorganisms. And of course, every time we void, we knock out some of those organisms. So the voiding gets rid of toxins in our body, excess water and so forth, but it also flushes out microorganisms. That's why it's important to visit the bathroom maybe every 4 or 5 hours, and you just keep knocking them down. It's kind of like brushing your teeth every morning. You're never going to get rid of the organisms, but you can reduce them to the point where they cannot create a problem for you. So he showed me this girl's plate, and if you remember, let me see if you remember this. You remember when we grew some organisms on EMB? And do you remember that one organism in particular produced a very brilliant green metallic sheen? Do you remember the genus of that organism? This could be kind of like a question on the final exam, couldn't it? Yeah. Anybody remember the genus of that organism? That's correct, Eugene. Correct, Aisha. Uh-huh. Now remember, the genus is the full name. So if I ask you for the genus, make sure you put down Escherichia. That's right. So just make sure you do that. If somebody asks you your first name, you don't say my first name's J or K or whatever. Good, very good. You guys remember that. Well, that plate that he gave me from that student who took that urine sample and then swabbed it on the EMB plate, that whole plate was metallic green. He didn't pursue it any further. Of course, he had already taught some things, and I hope she picked up on it, but somehow her hygiene is not what it should be. She is what they call an infection waiting to happen. The other kids, they had a few colonies of metallic green. This lady, I guess, needed a little bit of training or something. But anyway, the systems are close to each other. Therefore, there can be a transfer of bowel flora, or I should say bowel microbiota, to the urinary tract. So when you think about the urinary tract, voiding is a very important factor in the health of the urinary tract. As I said, somewhere around every 4 or 5 hours, and you knock out a number of them. You don't get rid of them, but you do reduce the number. You know, how many organisms you come in contact with is going to determine, in so many cases, will an infection be established or will it not? Now, as you look on page 619, we already know that flushing is a mechanism to keep the organisms down. We come down to that first column and you see normal microflora, or you can change that to microbiota. They want us to do that because we think of flora, we think of florists. They're not plants, they're organisms. I don't know if they're animals or not, they're one-cell creatures, but they're not plants. They don't produce chlorophyll and grow roots and things like that, like we typically think of plants. But anyway, look at the first sentence there under normal microflora of the urogenital system. Healthy individual, all parts of the urinary tract except the portion of the urethra, that little 3/8 inch or somewhere in there, closest to the urethral opening, are sterile. As far as we know, there are no microbes growing in our kidneys or our bladders or our ureters or anything like that. So all parts of the urinary tract, kidneys, ureters, bladder, and probably 90% of the urethra is free of microorganisms. It's that where the meatus, you remember that term? Meat, M-E-A-T, and then meatus, that means a tubular opening, and so that can have microorganisms in it. Nothing irregular about that. But you come down into that paragraph, and if you come down about 1, 2, 3, 4, 5, 6 lines, you see that genus Escherichia, and you see lactobacillus, especially in the girls, because the girls will have lactobacillus in the reproductive tract. Remember, that keeps the pH down around 4, and that is a healthy pH for the vagina. So having established that and knowing a nonspecific defense mechanism, you remember how we listed flushing as a nonspecific defense mechanism? Remembering that, let's go over and look on page 621. Page 621. And you see it says urogenital diseases, usually not transmitted sexually. So as you look on the first column, you see the term urinary tract infection, and there's your abbreviation UTI, among the most common of all infections seen in clinical practice, second only to respiratory. So you see, we have a hand in keeping those tracts healthy. One of the things we're doing today is we are wearing masks when we're outside. In most cases, I see people with that, and we know that the people in the hospital are wearing those because of COVID-19. So taking care of the respiratory tract. How we take care of the urinary tract? Well, you have to practice the correct hygiene, and then on top of that, voiding every 4 to 5 hours helps to keep the number of organisms down, like brushing your teeth. So as you come down, we're going to list a few of the infections of the urinary tract, and you see you come down about 1, 2, 3, 4, 5 lines. You see urethritis. Anytime you see ITIS. Did I tell you that I know some of you were praying for my wife, and I appreciate that so much. They diagnosed that she had temporal arteritis. I don't know if I told you that or not, but it's something that sometimes happens in our age group. We're in the 70s. And so the endothelium of the temporal arteries on both sides of her head were inflamed. Sometimes they call it giant cell arteritis. And that's where a monocyte and macrophages begin to release cytokines that can irritate the lining. It can result in death. It can result in an aneurysm. It can result in stroke. It can result in losing eye vision. We're thankful to the Lord that we got there in time. And now she's on prednisone, which is reducing the inflammation. Her jaw doesn't hurt like it used to. She's starting to be able to chew things again. It was no fun at all. Very serious. So I appreciate your thoughts and your prayers there, very much so. Anyway, you get an infection in the urethra. Amen. Amen, Eugene. But you reduce that possibility of getting urethritis when you void. Drink enough fluid, too. Drink enough fluid. Now, I want you to look at the next one. We're moving up, and you see cystitis. And cystitis is an infection of the bladder. Now, before we go any further, I forgot to do this. I would normally draw it out on a board, so I'm trying to get it in my head. When you think of urethritis, the urethra will burn when you urinate. That's because the mucosa has been damaged, and the acid in the urine and whatever other toxins are in there can irritate the exposed tissue. So you'll have burning on voiding when you have urethritis, and you will have itching. Urethra will itch when you're about to get yourself a case of urethritis, and when you have it too. How would they find that out? Well, they take a urine sample, they go look at it in the lab, and they would gram stain it and say, oh, there's a bunch of gram-negative rods in there. And it's normal to have some, but when they see a lot, they know they've got an infection established in the urethra, usually gram-negative rods. And one of the things that we'll eventually find out about the urinary tract is that 80 to 90% of the urinary tract infections are caused by Escherichia. It's a good little helper for us in our bowel, but you don't want to get it over in the urethra. Now, there are other organisms that can cause it, and you might want to write these down. Proteus, Proteus, that's another gram-negative rod. Difficult to differentiate from Escherichia under the microscope, so we put it on differential media. So there's a couple of organisms that could cause the problem, gram-negative rods. Everybody okay with urethritis? And you come under that term cystitis, that's a bladder infection, as we mentioned. With a bladder infection, you could run a fever. You could have lower back pain. You could have pain above the pubic bone, suprapubic pain, they would call it. Now, there are some ladies that seem to have a number of cases of cystitis during a year. Let's say 6 or 7 cases, incidents each year. And what might the doctor ask them to drink in order to reduce that incidence? Good. Cranberry juice. Now, we're not talking about cran grape or cran apple. We're talking about pure cranberry juice. It's rather tart. Some people like that taste of tart, just like some people like garlic and blue cheese dressing and stuff like that. Others don't like that. But it's got a chemical in it that breaks the adhesiveness of pili. Now here we are going all the way back to what, chapter 4? You see, this stuff continues to build. You want to keep it in your mindset. So, when you go to test 4, review some of the things in test 1's material and test 2's and test 3. And then when you have the final exam, review the whole thing. The more you review it, the more it sticks with you. Then when you get into nursing and they start asking you questions and you go, oh, golly, I remember that. That was in microbiology. So that's one reason for our cumulative testing. So the cranberry juice has this component in it that breaks the adhesion of pili. And so when you break the adhesion of the pili, and you remember the function of pili, go ahead and don't do it now, but make a note. Go back and look at the function of pili. I think we listed 1, 2, maybe 3 different functions. So you limit that organism's ability to establish a focus of infection. Now, some people that hate that taste of cranberry juice, so they may even throw it back up. They just don't like the taste that much. There is a product called Cystex, Cystex, Cystex. It's a capsule containing the same substance in cranberry juice in the capsule. So then you can take those capsules and they will, of course, melt in your body. You'll absorb it, and then it goes through your urinary tract, and it tends to reduce the number of organisms hanging on to the meatus. So you got some lower back pain, maybe. You might have a fever. You've got suprapubic pain. And, you know, one of the things that is indicative of a urinary tract infection, cystitis, is the person has to void very frequently. They have the sensation that their bladder is full. And so they're always going to the bathroom, and they go in there and tinkle, and 15, 20 cc's, something like that. Felt like they had a bladder full of 400 cc's. But that's another sign that they need to, that they probably got a urinary tract infection. Now, why is that the case? Why do they feel like they need to urinate more? Well, the reason they feel like they need to urinate is that the stretch receptors in the bladder are being stimulated by the inflammation. Now, having said this, and having mentioned cranberry juice, if you have a bladder infection, this is not the time to start drinking cranberry juice. Cranberry juice is a preventive. It is not a treatment. You need to get an antibiotic. Now, let's mention something about the male and prostatitis. If you come on down in that paragraph, you see the term prostatitis, infection of the prostate. Don't you dare call it the prostrate. Now, there are a lot of people outside of the classroom. They say, "Oh, I got a problem with my prostrate." Well, that's just what they've heard in the culture or whatever it is. And you know how people don't think and don't know and don't speak like you're going to speak and think and know. So prostrate means you're lying flat on your face. Now, if a guy's got prostatitis, he may be prostrate, flat on his face, but don't mix those two terms up. So look on the facing page, if you would, on page 620. And you look at the bottom picture, there's a sagittal view of the male reproductive pelvis, of the male pelvis with the reproductive structures and the urinary tract. So you look where the prostate is, and running right through the prostate is the urethra. So when a male gets prostatitis, he may have a difficult time releasing his water. Because the prostate swells not only outwardly, but it swells inwardly, and it pinches, it constricts the urethra. So it's hard for him to get his water out. Everybody pretty clear on that? Now, I want you to look at the next paragraph. There's a couple of things in there. It starts with a major cause of UTIs. A major cause is incomplete emptying of the bladder. Now, that's one of the problems that older men have. The prostate tends to enlarge over time, and it can squeeze the urethra, making it difficult to get all the water out of the bladder. Anytime the water stays in there for a period of time, for a longer period of time than it should, sometimes microbes will get up there and they will begin to grow, and you end up with a UTI. So one of the things you'll encourage your patients to do is always get all the water out of their bladder. And of course, they've got chemicals now, medicines that they can give men that will actually shrink the prostate a little bit, open it up, and then the flow can be reestablished. Now, if a guy gets prostatitis, he'll usually have a fever, 102, 103, somewhere along in there. He's not going to have a whole lot of pain down there, but he's going to have a hard time maybe turning his water loose. Now, you know, some guys will not have that problem. A millimeter more of diameter in the urethra means a lot. So some men have larger urethras than others. It's just like some ladies. Some ladies will give birth in 5 minutes when the kid's here. I've got a niece who's like that. She says, we need to move to the hospital. And then, you know, about 2 seconds later, she says, he's already here. You know, so some of them give birth easily. Some of you are on the table, you know, 10, 15 hours or something like that, trying to get the kid to come out. Well, the same thing's true with the male urethra. They can vary a little bit in diameter, and the larger that urethra is, the more likely he's not going to have any problem letting his water loose if he has prostatitis. In the second column, I want you to look at that first paragraph. You look at that paragraph and look at the last 3 lines of that paragraph. You see it says people with various kinds of paralysis who cannot void completely tend to have frequent UTIs. Some sort of paralysis, and some of them will have to live with a catheter. And here's where catheter care, anytime you've got an indwelling catheter, I think they call it a Foley. I guess they still do that. That's what I worked in a hospital when I was in grad school, and I'd catheterize the male patients and do all kinds of interesting things. You got to clean that catheter up. Fun? not for the person who's got the catheter. But a good, thorough job can reduce the population. It's like brushing your teeth, and you end up reducing the number of microbes, which makes it difficult for them to create a problem. So hopefully your patients will suffer through it. I think they do it twice a shift or something like that, at the beginning of a shift and at the end of a shift. Let's go down to the next paragraph where it says UTIs originating in one area often spread throughout the urinary tract by climbing, ascending, or by descending. But you see the term there, when I say got a kidney infection, then you see that word pyelonephritis. Where would that name come from? I just see your answer there, Amanda, and that's good. Pregnant women, yeah, they can have a problem sometimes with that too. That's good thinking. I didn't include that, but that's good. Where's pyelonephritis come from, anybody? Not sure about where it begins? Think about, what is the filtration unit of the kidney? Okay, now that's a component of that filtration unit, Eugene. That's not the whole structure that we're looking for. The glomerulus, there you go, Eugene, that's it. The nephron has a number of components, and of which the glomerulus is where the filtration of blood occurs. Amanda, but that's not part of the filtration unit, Amanda. So if you have bacterial infection in the bladder, you have cystitis. The infection is not up in the kidneys, okay? So the filtration unit of the kidney is the nephron. Now, I'm trying to get you guys to remember what you covered in 211, wasn't it? I think I've set up to teach 211 this fall. I haven't done it for years, but it's real interesting stuff. You know, fluid and electrolyte balance and so forth, and acidosis and alkalosis. Interesting stuff. So if you have a kidney infection, you could be running a fever, 103, 104. You could have lumbar pain. Might be nauseated. I want you to look over on page 622. And look in the second column. and come down to the bottom where you see that term pyelonephritis, which is another term for a kidney infection. And as you look, let me count these lines here. You got 1, 2, 3, 4, 5, 6, 7, about 7 lines. And you look over to the right and it says Escherichia coli causes 90%. Now that can vary. You see of outpatient cases, but 90% are caused by Escherichia. And the girls have a tendency to get things like this more than the guys, because the girls' urethra is only about, what, an inch long or something like that, 3/4 of an inch. Guys have about 5 or 6 inches of urethra. It's a little harder for the microbe to get up there that far. Not the time to drink cranberry juice. Don't start doing that. Go to the doctor immediately, because you're messing with your nephron when you have that kidney infection. Don't want to ruin that. You can't make any more of those. You know, we can create skin and scar tissue, but you can't reproduce your nephrons. Now, I want you to look on 623. And on 623, you can look in that first column and you see glomerulonephritis. Now, I'm not going to say anything about that, but I want you to read it, okay? And you think about it, it's something that it's similar to what we have talked about before in another part of the body. I want you to try and make that connection. So you're going to read that paragraph all the way over to the end on 623, that second column. It's another great example of when you talk to your patients. After you read this, when you talk to your patients, and some of you may be PAs, some of you may be MDs, it'd be great to see you guys when this body of mine starts wearing out and caving in, and some of you are doctors and nurses and PAs and stuff like that, and you take care of me. It's always encouraging to see my students come in. It's kind of like a nice reunion. I had a kidney stone one time, and one of my students was the one who was the nurse anesthetist, put me to sleep. Like homecoming. It was good. Like to see you guys contributing and enjoying your work. Anyway, see if you can relate it to a problem you're already familiar with. Okay, we're going to look at just a couple of vaginal problems, called just bacterial vaginitis, on page 624, second column, 624. Now, that is not an STD. That is a disturbance of normal microbiota. You remember we got a lot of things, homeostatic things in our body, don't we? And one of the things is the normal microbes in us and on us. And so we try to keep a balance there. Brushing our teeth is, I don't know if you want to call it a homeostatic mechanism. because we have to make a choice to do that. We've got homeostatic mechanisms that are going to balance the temperature and the pH and so forth, and you don't have to think about it. But it is sort of a homeostatic mechanism in the sense of keeping the number of microbes at a particular point. So as you look over on page 625, looking at a type of vaginitis, bacterial vaginitis, you come down that first column and you see Gardnerella vaginalis. Now that is the genus and the species of a little gram-negative rod. You see vaginalis. Vaginalis just tells you that it's located in the reproductive tract of the female. Vaginitis is the inflammation of that canal. So as you look through here, if you come down to line 5, not everybody carries this now. Not every lady carries this. You can read through that, and you'll see 20 to 40% of the ladies can carry it, long as the pH is okay. That's fine. But now remember, antibiotics can upset that balance. They can knock out the good guy called Lactobacillus acidophilus, and the pH starts to rise. And you see there in line 5, when the vaginal pH reaches 5 to 6, then Gardnerella vaginalis, if you have it, can create a problem. Now, we're not going to go into all the other organisms that help it create the inflammation. So as you come through that section, you will see, let's see, where did they've got it saying that. If you come down to line 11, they'll call it nonspecific vaginitis, because although Gardnerella is one of the organisms causing the problem, it's not the only one, so they'll say non-specific vaginitis. It's not an STD, okay? It's usually some kind of condition like taking antibiotics. Sometimes ladies try to be too clean. You know, you can brush your teeth too much. I've seen that happen in a dental class when I taught micro. And, you know, people just sort of think along these lines, well, if one vitamin E helps me in some aspect of my health, you know, 2 or 3 vitamin E's might really help me, you know. That's not necessarily the truth. You can get toxic on some of those things. And sometimes we can brush our teeth too many times. I've seen that happen where the girls, this one particular girl, knocked out all these microbes. And when I looked at her specimen from her throat, it was pretty much all yeast. And I thought, wow, tell me about your oral hygiene. And she was real happy. Well, I brush 4 or 5 times a day. Well, you know, it's like taking too many showers. Balance it out. If you can't smell everybody, that's okay. It's good. We're probably doing good. Now let's look over to page 627. We're going to look at an STD now. And you see gonorrhea in the second column. Now, you already are familiar with that name. You know, Neisseria is the genus, little gram-negative diplococci. And so you come down about 8 lines into that paragraph, and over on to the right, you'll see the causative agent, Neisseria gonorrhoeae, and then a gram-negative spherical, oval, or oval diplococcus. That's your culprit. Now, when guys get gonorrhea, And you can look on the next page and you'll see this penis with pus coming out of it. Look on the next page and you'll see that. Guys will usually have an itching urethra. They'll have some pain on voiding. And they can have some pus coming out the urethra. Now, the interesting thing about the girls is about 70% of the girls don't show any signs or symptoms. About 70% of them do not show signs or symptoms. This is one of the dangers when some girl wants to get in bed with a guy. That probably means she's been in with a number of others and you have no idea what she's carrying. It's just, it can get you in big trouble. Now, not showing signs or symptoms, the problems with that is, number one, she can spread it to everybody that she comes in contact with. A second problem with gonorrhea is that it can damage the fallopian tubes. It can move up into the uterus and into the fallopian tubes, and the lady can become sterile. She could actually have an ectopic pregnancy. Sometimes they call it a tubal pregnancy, because the organism has wiped out the cilia that typically carry the ovum, the fertilized ovum, down the tube into the uterus. So if it destroys the cilia, then the little egg may not move any further down the tube toward the uterus, and it will implant in the tube, and you got a big problem. So the best thing to do is keep your britches on. Any question about gonorrhea? Now we're going to skip a number of these reproductive diseases because we just have a few more minutes. And by the way, this is not going to be on the fourth test, but this will be included on your final exam that you'll take next week. So let's look on page 639. We looked at one bacterial STD, and now we're going to look at a viral STD. And most of you have heard of it. You see on page 639 in the first column, it talks about herpes virus infections. HSV1 is fever blisters. and then HSV2 is what's seen in the reproductive tract. Now, people can get HSV1 in the reproductive tract and HSV2 up in the oral cavity, depending on their practices. So they show the same kind of signs and symptoms. I'm not sure exactly how they're different. I have not researched that to see protein difference in capsids or whatever. But people can get problems in all parts of the body. Now, thinking about genital herpes, look at the picture to the right. This is figure 2020. And you look at the penis of the drawing there. And tell you what, look over on page 640, and you can see a penis there with a number of blisters on it. Those are painful, just like the fever blisters people get along the mouth, very painful. Eventually, it'll go away in the sense of signs and symptoms. But look at the penis on page 639 and follow the black arrows, and you see they go to a structure called the Sacral Ganglia. And that's where they, can we say, are dormant? We use the word latent, meaning they're hidden in your body and they can come back out later. They're not going to move up the ganglial line on either side of the column, the vertebral column. They're going to stay there, and if they become active again, then they come out the same place on the body, in this case, the genitals. A lot of pain. You can see up there the person's mouth. They go back to the trigeminal ganglion, and there they stay. My wife carries that virus. I never got it from her. Of course, she didn't want to kiss, and I didn't either when she had one of those sand pits in her mouth there from that organism creating a problem. But eventually, she seemed to develop, I guess, enough antibodies to keep it in check. She hadn't had anything like that with her lips, probably in, I don't know, 35 years, something like that. Now, notice the person's finger. And we think of that palm as being pretty tough, don't we? But you, on the other side of your fingers, you got just 4 layers of skin, but you can develop a herpes lesion on the hands, depending on what you put your hands into. Sometimes people might do things to avoid pregnancy, but they'll get things on their hands. And you see, you follow the black arrow again, it goes up the arm and goes to the brachial ganglia. So why does it like that? Well, we don't always know all the things. We know it can get in there and stay. And evidently, if it's not reproducing, then, our natural killer cells don't recognize that it's there. We don't have all the answers. We have some observations, but we don't have answers in many cases. If you look over on page 641, you can see what herpes on fingers can look, how they can look. And if you read about that, it says it can be spread to other parts of the body by rubbing your eyes, and we tend to do that, don't we? Do you have any questions? And remember, this is not going to be on the fourth test. Fourth test ends with the nervous system. So you will not be tested on this coming Wednesday, but you will the following. I guess we could probably knock it out Monday. Monday at 8 o'clock. So we'll have our final exam on Monday morning, 8 o'clock. I'll leave it open for you till 11. Most of you seem to have figured out that it takes a while for HonorLock to download that test. So I'll have it open at 8 o'clock, and you guys have learned to be patient, and it'll eventually come on. Just follow those instructions that I mailed to you. Do you have any question about what we covered today? Exam for Wednesday, and we'll do it at 8 o'clock. I'll have it open at 8 o'clock. You'll be able to access it at 8 o'clock, and you'll have to. Is 10 o'clock long enough for you? I know sometimes if it's slow, that can put some stress in your life, and you think, I'm not going to have time to do this. I can leave it open to about 10:30 or 11 if that's better for you. But most of you seem to be able to get it in. You're handling the HonorLock well. Just make sure you clear everything out of there so nobody gets accused of anything. We've already had a couple of kids doing some dumb things, not in your class, but in some other classes. And so that camera's working. They've already gotten zeros for that test. They get another one, they're getting F for the course. So spend your time wisely so you can come away happy that you did well, do the material. Okay, any questions? All right, well, I'm going to end this stream here. And I guess I don't know when I'll see you again. I'll have the test ready for you. So you guys do it well. I like to smile at my students' success. See ya. Bye-bye.